Our next guest is a cardiovascular surgeon and the founder and CEO of USA Vein Clinics, Dr. Jan Katsnelson. Thank you for being with us this morning. Can you explain to us about these new findings? Increased blood clots in COVID-19 patients. Why is that the case?
So there's a data from Mount Sinai and other studies that COVID-19 patients develop blood clots in legs, lungs, and other organs. Developing of blood clots is not surprising in such patients. Any person with decreased physical activity, like walking, especially patients that stay in a hospital, lie in a bed, they have a slowing circulation, more sluggish circulation that leads to creating the blood clots. That's why it's a common practice in a hospital for patients that stay more than a couple of days, start prophylactic anticoagulation therapy. What's interesting that for ventilated patients in a study of Mount Sinai, that such anticoagulants dramatically increased chances for survival. The presence of blood clots can happen not just in a hospitalized patient, not just in patients with COVID-19, but actually anyone can stay at home. Many patients experience swellings, heaviness, leg pain, and cramps that are typical symptoms of venous insufficiency, a disease that slows down the return of used blood towards the heart.
Yeah, and Doctor, are we seeing that more now? Because, we know gyms are closed right now. Not as many people are going outside, maybe exercising as much as they normally would. Is that why we're seeing that also?
Absolutely. Decreased physical activities and walking, weight gains, eating salty food that cause water retention are the main factors. And it's very, very simple to improve the situation. Just keep walking. Do your 10,000 steps around the kitchen table, march, just walk in place. Don't use any salt. There's plenty of salt and food preservatives. Elevate your legs 15, 20 minutes, 2-3 times a day, just sitting or lying down. That helps too. And sometimes wearing compression stockings and tight leggings also is useful to push blood up.
Yeah, those are some good advice. Good tips there. We want to keep people moving during this time as much as we can. Cardiovascular surgeon and founder of CEO of USA Vein Clinics, Dr. Jan Katsnelson. Thank you for being with us today, Doctor. Thank you.